I'd like to call the Henry County Council meeting of March 13th, 2024 to order. If you'd please stand for a pledge and prayer. First, we have on our agenda approval of the February meeting. I'm going to abstain because I watched it from out of state, but I wasn't here, so I would make a motion. I think the only change was spelling of the word rescind, so that got corrected. Accept the motion.
Motion to approve.
Okay. A motion to approve, and Shannon, did you second it? Down there, I can never tell. Whoever made the suggestion of rearranging this to a circular, Debbie, I love that motion. A circular, because there's no way I can tell who voices are. Okay, it's seconded by Mike. Any discussion? If not, all in favor, aye.
Aye.
Opposed, nay. I abstain because I wasn't here in person, so Betsy, did you want to get in on the minutes of the last meeting?
I voted them and I approve, so I would
You
say
approve?
aye.
Okay,
I apologize for my delay.
that's okay. Five A's. Yeah.
And I apologize for
Ayes.
being late. I think you guys heard all the sirens. There's a really, really bad accident at 3 and Broad. And
You weren't caught in it, so.
yeah, I was. I mean,
Oh, but
it's
not
really
in it,
backed
but
up. So
delayed because of it. Okay, well, again, hopefully speedy recovery, no one hurt badly. Okay, that passes 5 with 1 abstention. Okay, we have EDC, and that's Penny.
Hello, friends. So Corey's out of town. He's been at a destination development meeting down in Evansville. And so we are just busy doing all things Eclipse, which I'm sure you're well aware of, lots of news articles and things. So if I can direct you to any questions about that, or any of your constituents would have any questions, hoopsandhenry.com/eclipse. There are guides, there are informative articles, there are lots of things on there for your consumption that would be good to read prior to coming, prior to the event happening. There are t-shirts for sale on there. We haven't had a lot of people go for the t-shirts, maybe closer to the time they will. But anyway, it's a really great design, and we'd love to see you all getting one and wearing them leading up to it, to the event. So economic development is still turning. We've gotten several leads this week. Nothing particularly that we can submit to, but we are busy. And so do you have any questions at the time?
Where do we get Eclipse glasses? I assume several
Well,
organizations still
come
have
over to our office in that front corner door. There's a basket of glasses there. We've gotten 1,000 of them, and I bet we've handed out a couple of hundred, but they're there for anyone that would want them. And so we're bringing them to our board meeting in the morning, too, if anyone's going to be at our board meeting. So we have plenty of those at this point in time, and they're anyone's until we run out.
Yeah, that's good to know. Do you have any Ready update? I haven't heard anything in about 6
No,
months.
nothing new on Ready at this point in time. Any other questions?
Any questions from the council over the EDC, Ready, Eclipse? I think we have something about the Eclipse coming up on the agenda, like 50,000 for personnel, extra EMA, yeah, okay. Very good. Thank you.
Yes.
Chalcori High. Chamber, I called Cindy, and they did not think they have a lot on their agenda, including their annual gala next week. They didn't think they'd likely be here, and they're not. Okay, ordinance to move money into the rainy day fund. Do we have that? Somebody have that, they can tell me how far into the packet it is. Okay. Okay, resolution 2024-03-13001. $39,374.39 of revenue from the bond proceeds remains in the county general fund, and $25,154.43 remains in the debt service established to pay the principal and interest under the bonds. Effective date upon the adoption, if passed today. The debt evidenced was paid off on January 10th, 2024. Any questions by the council? If not, we'd entertain a motion to approve this transfer resolution.
So moved.
Moved by Betsy. Do I hear a second?
Second.
Second by Susan. That was easy to determine who spoke. Discussion. If not, all in favor of this resolution dated as shared, aye.
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 Opposed, nay. Welcome, Kyle. That was now up to 7-0. Okay. And council, you may have to help me because I didn't look over the packet order in advance, so rather than wasting time looking through it all. Okay. Next, we have paying for the court's recording system out of the rainy day fund.
Do you know what the total is?
Okay. So any action the council needs to take? Repeat that. Exactly what language do we need to approve?
You just need a motion to pay the cost for the
Record from the rainy day fund. Okay, very good. Do I have a motion to that effect?
I would make a motion that we pay the cost of the court recording system from rainy day funds.
Okay, it's been moved.
Second.
Seconded by Shannon. Any discussion? If not, all in favor, aye.
Aye.
Approved, nay? Opposed, nay? Gosh. Passes 7-0. Additional appropriations. This is in our packet, Debbie. Aries is, because I saw it. Aries is in the amount of $62,644.50.
I would make a motion that we do an additional appropriation for the Aries grant of $62,644.50.
Been moved by Susan,
Second.
second by Kyle. Discussion? If not, all in favor of the motion, aye.
Aye.
Opposed, nay. Passes 7-0. additional appropriation of the health fund, and I thought I saw Angela, but I don't see. Yep, there she is. She's in the back. Okay, please find the request for additional appropriation of $23,000 from 1159. Purpose to cover the 5% salary raise that we approved last fall. Please let me know if you require any other information. I don't think so, unless council has any other information needs. I knew that was likely coming, but do I have a motion?
So moved.
Moved by Shannon,
I'll second.
second by Mike. Discussion? If not, all in favor of this $23,000 for said purpose, aye.
Aye.
Opposed, nay. Passes 7-0. 1235 PSAP fund. That's the 947 that we need to pay. 947,392. Any discussion?
I just have a question. Are we appropriating all of the receipts we've received, or just to cover a specific amount of bills listed here? What we're anticipating for the year. Okay.
Yeah, we did not have a fund set up to have a budget for it, so this is basically creating that budget line items with the dollar amount we anticipate. I will make the motion to appropriate $947,392 to budget 1235 for 911.
Shannon, I hear a second.
I'll second.
Susan beat you, Mike. Seconded by Susan. Discussion? If not, all in favor of the motion, aye.
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 Opposed, nay. Passes 7-0. Approval of expenditure of revenue received from the ARPA. This is for the EMA that we alluded to, extra safety personnel, et cetera, EMA for the eclipse weekend of April, basically 5, 6, 7, 8.
I'll move to approve the amendment as presented.
It's been moved by Shannon,
I'll second.
second by Betsy. It's number 32, the sum of $50,000 for the cost of additional law enforcement, firefighters, emergency medical service personnel to be on duty throughout Henry County during the 2024 solar eclipse. We've had a motion. It's been seconded. Any other discussion? If not, all in favor, aye.
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 Opposed, nay. Passes 7-0. Health Department, again, Angela's here. When you come up, I want to commend you and your department for a very noteworthy award. That was reiterated in a meeting I had this afternoon with Miranda. Probably the highest award given out by the department at the state level to any county, and Henry County largely because of your work and the work of your employees and staff. Well-deserved. So commend you.
Thank
for
you.
a job well done. So you have information for us.
Okay, yeah, this is information that I wanted to kind of put in your head so you can start contemplating it, and then I'm hoping to come to your work session to hear some of your ideas to kind of help me figure this out. But I do have a curious question. The additional appropriations here, I'm assuming, am I the only department that had to come and ask for additional to cover the raises? Why didn't the park? They're in my tax levy.
The park has excess funds for those raises because of the way we adjusted. They were taking on it more of a burden for health insurance than they should have. So when we readjusted, that gave them funds.
Then that gave them funds back.
Right, and I have not heard from the highway department if they had trouble covering their raises. they transferred funds within rather
Now,
than getting the
do they
additional.
pay salary out of this particular tax levy? I've asked that question 101 times. So everybody at the highway department is just like me in that boat. We're the tax levy stepchildren. So I say that with love, okay? But it's true. All right. So a couple of things that you do need to know moving forward. So the $23,000 that you just appropriated for these additional, that takes care of the raises, but I think that takes my final approved 1159 budget from $692,450, which is what we did at the end of December. Brings that up to $715,377. Looking at what I brought forward this year, I was around $87,000, and when I walked into 2023, I had $224,000. So with what I spent in staffing and, which is what that was in 2023, plus what I had to dig into a little bit to cover the increase in the longevity, that put me under. I was hoping to come into 2024 with $125,000. So I didn't do that. So I'm already under. So I knew right then, January 3rd, I wasn't going to make the $692,450. Well, there's no way I'm going to make the $715,000. It's not going to happen. So I'm trying to get ahead of this so that I don't end up in the red and have a very embarrassing moment and have to come to you and say, you need to bail me out. So looking at what we've got going on, I had, in this side of my budget, had asked for a community health worker and a systems of care coordinator, and then I would put the JCAP therapist in. So I went ahead and kind of pulled that trigger toward the end of last year. Not sorry I did it, but it does make me a little tight. So for 2024, I will not be hiring my community health worker or my systems of care coordinator / educator that you approved because I just don't think it's going to be there. Maybe toward the middle of the year after first settlements come in and I have a better idea, maybe so. And part of the issue is last year was so hard with the 1161 or the new health funding coming in because they wanted us to do everything right now. And most of us were trying to balance out what do we leave in the 1159 fund versus what do we put into the new fund. And so I moved myself, our health officer, and my 3 department directors into the new funding, which I do want to make note that's $15,000 with the raises in the 1169 fund that I now have to cut out of line items to put up in there. So that's going to be our problem moving forward if I don't know by June the 1st what we're doing with raises. So it's doable. It's not going to be pleasant. I mean, that was pretty much my server. And, I lovingly said we're the tax levy stepchildren, but I pay $20,000 plus for IT services. Jeff does very little for us. And for one IT guy for the entire county, I don't know how y'all are doing it. The man is run ragged, and there is no way he can keep up with my department. And so we pay for that outside. So this year with the new health funding budget, one of the things that I had to be able to tell the state that I could do is if that building blows up, Angela can set up shop within 24 hours outside that building. So all of my stuff is backed up offline with Octal Systems. We all have laptops. Everything's on the server. So a lot of the funding that I had in the new money went to IT things this year, which I won't have for next year, but we'll have to budget out about every 3 to 5 years. So again, that's $15,000 that I'm going to have to make an adjustment. I do go to Indianapolis to meet with the financial advisor with IDOH, because we're now required to do that with the new money. So I will take this to them at that time, and we'll make the adjustment, and then I will have to come back to you all after April the 2nd for you to approve the amended budget with that. So, which leaves me to ask you about our group health insurance. In the beginning, when we sat down in our work sessions, we budgeted for 12.5 FTEs and increased our group insurance rate from $130,000, and we had planned for $260,000, but you were able to give me a little break there, and we came down to $247,500 with that. Right now, you know, with the 2 new positions that are not coming, I'm going to be paying health insurance for 2 employees that I don't have this year, and I don't know if that's how that works. How can I pull that back out of that line item? Do I just leave it in there until mid-year and we kind of see where we're at, if I could possibly hold them and continue to pay at that rate, or can we take it out now? I don't know what the
Might
appropriate
be
thing to do
a
is.
Debbie question. I don't know the exact count number, but you have that money there. Can she transfer it into something else if it's not needed? The health, she's like, how much over?
Gosh. What we budgeted $20,000 per person. So if you took the 247,500, and divided it by 20,000, that gave us 12.5. And so right now, with an RN position that I did bring on full-time, but she's currently this year being paid out of a grant fully, except for the health insurance,
Okay.
brought me up to, I think that puts me at 10.
So the number that during budget session, we have to take the total insurance premiums and costs and everything and allocate it. And we noticed that sometimes some department, it works fine with all the other departments that don't have their own levy, right?
Right.
The ones that do have their own levy, we were giving them an allocation, so they paid for it. And then what we realized is some had way more of an allocation because they used to have a lot more full-time people that were taking insurance,
Right.
and some did not.
Right.
So the number that we used was 22,500, not 20,000. So 22,500 gave you 11 full-time equivalents.
Okay. Excuse me.
And that, what we did is we had HR tell us how many employees you had that were taking insurance of some kind,
Okay.
plus 1.
And I remember that discussion with the plus
Right.
1. in
So
case.
my assumption based on the calculation is you had 10, we added 1, that gave you your allocation of 247.5.
Okay.
Now, if you were to hire, and I don't know, how many full-time equivalents do you have altogether?
Well, right now, I have 8 people. I had Stephanie look at that. I've got 8 people
Okay.
with insurance. And then,
So we were anticipating 2 of your new ones having insurance, so that would have been the plus 1. So the real question then is, can we free up those dollars and move them to another line item or something for you?
Right.
That's something that we'll have to, I think, discuss with. Right. Mhm. Well, they were for $2, they were for 2 employees that we didn't hire, though.
We'll just come in under in expense.
Right. That's what that's what I was thinking anyway. I think that's the only way it could be done. Other than that, we ran into areas where, you hired more or you replaced somebody that wasn't taking insurance with somebody that was. And that the insurance is really kind of messy with the allocation thing, but.
oh, it is messy. And I finally have the magic piece of paper that I wanted to share with you. I'm framing it in my office.
Great.
I'll be here 8 years on May 17th. For nearly 8 years, I have asked this question, and finally, I have an answer. So your COBRA rate for medical for one employee is $957.37. Your COBRA rate for an employee and a child is $1,723.27. Your employee and spouse COBRA rate is $1,914.74. And then a family medical is $2,680.64. That doesn't include the little bit of dental and vision that goes on with that. And so Susan and I had a conversation because this came up in regard to an employee that I have with a federal grant that I budgeted $20,000 for group insurance because that was the ballpark I was shooting for. And so anyway, in the midst of having to comply with federal regulation and figuring this out, I learned that because this is a single employee, we were overpaying. And so what I had asked when I talked to Susan, she's my representative, I wanted to okay it with her, but I had to correct that to make it accurate. And so I did, and I feel like I can, cover that person quite nicely in what we have. But if you look at the 8 employees that I have, just for argument's sake, I have 1 person who takes family, I have 5 who are single, and 2 that have insurance with a dependent. And so with those 8 individuals at those rates, and I included the dental and the vision, I think that comes up to like $135,553. That's a far step to the left there, or the right, whichever you want to look at it. And I get it, and I know why you figure the way you figure, but all I am asking is that I don't see moving forward how I'm supposed to sustain any of these positions when I get nothing other than what I can bring into the equation by increasing our fees at the health department. And I've been told time and again, previous administration, well, you're lucky, Angela, you can raise the fees. Well, that's the same difference as raising taxes, I would assume, if I were in a politically, chosen position, because every time I raise the fees, every time somebody comes in the door. And when I took the position almost 8 years ago, it hadn't been done in almost 20 years. And so we had to raise the fees fairly significantly, and that wasn't much fun. It was about as much fun as you guys having to go from a 1% to 2% raise to a 5% raise. That wasn't fun for anybody. So I'm asking for you to think about those of us who are not in the general fund, how I'm supposed to budget and anticipate an increase in salaries and insurance premiums when I just can, eventually we'll meet, we'll be back down at the bottom of the barrel again. And I'm trying desperately to keep that from happening. And I have told the legislators this too. We're doing an every 2-year budget. I am as scared as any other health department administrator out there that in another year, when they start talking about the next year's budget, that with the $1 billion shortfall that somebody in the state somehow seemed to overlook, not sure how that happened, but we know where that's going to end up. Our funding's going to get cut with that. So all of us are we don't even know what to do with this money, right now. It's overwhelming, and I need help. I'm not an accountant, did not come to that by trade. All I can do, and you don't know what you don't know, as council people being new, you don't sit in Debbie's seat, and I'm not asking you to be accountants, but we have the means to pull people in, that can help us figure that out. And as much as I think of Jason Simler, I remember 7 years ago, I drove to Indianapolis and sat across his desk, and he said, Angela, the only option you have is to cut staff. You have no funds. And he laid it out as clear as it could be. And I just feel like there just needs to be something has to change in order for us to move forward. You know, I want to do a good job. I'm not being frivolous with the money. Everybody needs insurance. That's why people take jobs, you know, it is. And, the other thing that I need to ask you desperately.
Before you move on, I would like to say, I will do what I can to help. I'll commit to trying to help figure this out.
Okay.
I will do some research to figure out, we can't be the only county that has this problem.
No.
How others are allocating their insurance or what they're doing, I have no clue, but I'll dive into it some.
The
and-
one
and council will discuss.
administrator that would talk to me candidly, because, you know, we tried to talk about things, and I remember saying to him last year, and he's up in Jay County, but I said, what happens when your county gives a raise? What happens with your 1159 fund? He said, well, we get more money so that we can accommodate the raise. I said, how? Well, I don't know. We just do. Okay, well, I need to know how. So that, you know, I would have brought that to you a long time ago if I'd figured that out, but I don't know how. But lastly, I received an email this week that the 1161, the new funding budget, is due to the IDOH on January 1st. 2025 is the year, and I'm so scared to even say this out loud, that you have the option of cutting the 1159 fund. I am begging you. I am begging you not to do that. And if you're going to do it, I need to know by May the 1st at the absolute latest. Please. Okay, thank you.
And I think we're going to experience a lot of unknowns with insurance overall. With what I'm reading in the paper and listening online to previous meetings, our liability insurance and our deductibles are going to be sky high. And I don't know if we're going to be able to figure out exactly how that's going to affect the budgets at this point, if there's been any projections. We can get into that discussion because I know you two had to sit down with Josh Estel. So I won't steal your thunder later on in the itinerary, but there's a lot of unknowns. We don't get the comprehensive plan for Baker Tilly until June 15th for us to be able to tell you the things you ask. Prior to that would be using a Ouija board and a dartboard.
Well, let's get the Ouija board out, sir, because I can't wait till June 15th.
Well, I'm just saying. I'm just saying.
Mr. Gray, I do get it, but I am telling you, June the 1st is when I got to have that in.
We can throw money out, but we won't know solidly if it's accurate by June 1st.
So,
I'm just telling you
well,
that's a fact.
then by all means, please, in your position as an elected official, I am not an elected official, you have access to everyone sitting in those seats at the State House. You have access to every one of them.
No,
Betsy, you know where their offices are at. I guarantee you. Susan, I know you've been over there. You've been to committees. Please go and tell them they just get it together. I mean, just get it together.
I have many times. And I'm on a Zoom with them every other Friday. So it's happening. Maybe not to your satisfaction, but trust me, it's happening. You made that clear.
Other than just saying thank you to Angela, I think a takeaway is we need to do a better job at insurance rates per department. And Debbie has already talked about being willing to get more accurate numbers. Isn't that, we talked about that with Angela, that you're willing to try to make those numbers more accurate. So that's something that we can do as a council, is talk about if we actually want to try to do exactly what each department, what it costs each department, what it costs the county for each department. But Shannon's going to do some research. So we appreciate your predicament. Thank you.
Thank you, Angela. Memorial Park, I don't know, must be Rita. I had down Casey, but it's Rita, who is a park board member.
Okay, the first one on the list, I think, is already taken care of, the internet bill. And the wood chipper, you guys have a quote for a wood chipper for us. We can't burn anything in the park anymore. The only way we've got to get rid of limbs and stuff is to chip it or whatever. And the county sold some of our equipment, and it went into the general fund, I think. And we was asking if we could get the money out of the general fund to buy a wood chipper.
And this was via an auction,
Yes.
an auction.
Yeah.
Okay. Susan, you're the liaison.
Yes.
You have information.
Well, I just had some things I wanted to pass along to the council. I wanted to refresh everyone's memory that when we did the park budget, Casey had put in for labor a to-be-determined amount, which in math translated to 0. So when we did the parks budget, we were not able to budget all of the funds that we're expecting to receive. So there are additional funds in the park, for the park, that need to be done through an additional appropriation. So I just wanted to refresh everyone's memory who sat through that budget session. So we are expecting $469,000 roughly to come in for the park. We budgeted around $350,000. So there's about $117,000 left that we can do an additional appropriation for. Our general labor in '23 was $177,000, but we only budgeted $118,000 because we weren't able to budget more than that initial request that Casey had passed along. So we have about $117,000 still for you. You probably need about $60,000 of that for labor. Casey had asked for 70. 60 would do what you did the previous year, 60 to 70, and you're going to have $50,000 to $60,000 left then to cover your raises, and then some other things that were cut from the budget. We cut the fireworks, we cut any improvements to the 4-H buildings because there was no money. But as a park board, you guys can talk about those things, and we can do an additional appropriation into your budget. It's possible that the wood chipper could be purchased from some of those funds too, though I personally think that it's reasonable that you receive the money from the auction, but we were going to talk about that tonight too. But I just wanted to give a background so we could start talking about, do we want to try to figure out which auction dollars could go to each department based on who put up items? That's a task for the auditor's department. Do we want to do that? And then we need to, at some point, fix the parks budget so they have all of their funds they're supposed to have and are able to sit down and decide how they want to use them.
What means are there to do that other than additional appropriation as far as to fix their budget? Because I know what was requested was not sufficient. I don't think it included all the salaries, and we readjusted.
Your labor is very short, right? Because we
readjusted.
budgeted 118, and we know they're going to need 177 if they spend what they did the previous year.
So what means do we legally have outside of additional appropriations? Because we couldn't go over what she put in her budget request, but we know that was insufficient at the time, but legally we could not go more than what she requested or what was posted at the state. So are there options that are, some options better than others? Additional appropriation, the most legitimate option? Okay, well, that's my question then. So.
I think we have to, and of course, it's better if we don't do additionals at the beginning of the year because it looks like we didn't budget appropriately. But this was just an instance where next year Casey will know to be determined isn't right. She'll know what it means to us, and we can also, when I sit down with the park board next year too, I'll be sure to watch out for that also. So it's just something that happened and it's fixable. And
Okay,
I think doing the additional it's better to do it now so the park has an accurate budget to work off of rather than trying to shift money around to pay bills. So I think it's what we should do to give them an accurate budget.
Okay. Are you suggesting that we do an additional appropriation for this wood chipper, or do we need to sit down and look at the overall budget and the shortfalls like you were getting at earlier when you gave a description of where they were short?
I think that the park board needs to submit what they're actually asking for labor, if they are actually asking for fireworks money, if they are actually asking for 4-H building money, if they want to have the wood chipper, and then they need to probably talk with Debbie to make sure they have the raise amounts correct, and Social Security and PERF, you said about 5% additional for that. So I think it's almost like a little mini rebudgeting to use up the rest of these funds. They have $117,000. That's, about 20% of their budget never was budgeted.
Correct, and additional appropriations they have to be advertised, so we couldn't do
Right.
anything, we just discuss it, and you're giving her recommendations how to proceed.
okay. So you're going to get with us to,
I can do that, yeah. And I can do that at the next park board meeting. I could come and sit with you guys, and we could make sure we have that done. And I can talk with Debbie first to get the can we do that, Debbie, and get the salary exact amounts for those things? And I think we should talk about what we want to do with the auction money, so that the park board will know when they have a conversation if they will get anything from that auction. Okay, perfect. Okay. Could you give us a summary version so we can talk as a council? So there's nothing to say, though, that we couldn't do an additional for the amount for that department if we want to.
Determining your budget, where you would put that additional, because you can't put it in the park's budget, because it's in county general, so it would have to come out of the budget here. to
Uh-huh.
pay for it, not that.
Yeah.
She'll get with you, and apparently there's some information legally from Joel that will need to be part of that discussion, because it sounds like it's a little bit more complicated on figuring out the auction part than we had expected. It's not going to be a simple process, or it wouldn't be a simple process. Okay.
okay. Now, the fireworks, you guys brought that up. We are getting donations. And from what I understand, it was a little messed up last year from a few of our donors. And it's working out a lot better than it did last year. So that's good news. And also, we've got plans for the eclipse. We're probably going to park cars out there for what's going on downtown. And then the day of the eclipse, we'll have places that people can set up their telescopes and stuff if they want to. And then we've got an Easter egg hunt, and we are filling about 30,000 eggs to hide for the kids. So we got that going on too. So
Those real egg or plastic eggs?
plastic eggs. I would not want to cook
I thought-
30,000 eggs.
I figured, but Joel and me made me ask.
Okay.
I'll just make one more comment. So if the wood chipper is very high priority for the park, and you guys decide that it's probably going to be something you definitely want to spend money on, whether you get auction money or not, but knowing you have some extra funds, they could go ahead and purchase it because the commissioners already approved the purchase. And if they have an equipment fund, a line item in their current budget, it's possible that you might, I don't know time-wise when you need it. I'm guessing you want it quickly, so you may not have to wait for us to go, I guess I'm just saying, you may not have to wait for us to make a budget, come and approve the additional appropriation in April. If you have a line item that you could pay for it for 6 to 8 weeks, knowing that additional funds are coming, if you're sure it's a priority. No, you can't do that.
Well, if they purchase it there, the additional fund in the general fund, you can't commingle those funds.
I'm not talking about the auction anymore.
Oh, I thought you were talking about the.
Sorry, I'm off the auction. I'm just talking time now. I was just saying because they have funds left over that they know are theirs. Sorry, Debbie.
Okay, we'll let you know.
And we can talk
the
about
meeting.
that too. Okay.
So we do need it, and there is a big pile on the other side too, that on the south side that needs to be taken care of too. So,
Thanks.
We're talking about issues that we were confronted with at budget time. One of them was last September, we realized that the state had written down wrong the code for an intended legislation, and we had to come up with $415,000 to take out of the jail lit, because instead of a 20% operational going to operation of the jail lit, it was written like 2% or 0.2%. So in the 11th hour, after we thought we had the budget, we had to pull out $415,000 out of inmate medical, uniforms, janitorial supplies, and inmates. That was 100% on the mistake at the state level. They gave us no other recourse than we had to move that $415,000 out of jail ed because it was a typo that went into the Indiana code, which they corrected this past month. My understanding, correct me if I'm wrong, Shannon, is that 20% actually goes to unlimited.
Correct. With a 0.2 tax rate, we can spend all of the receipts. That House Bill 1121, I know it's on our list to have a discussion about maybe, but it was approved by the Senate and the House and is on its way to the governor for signature.
Do we know if that takes effect July 1 or immediate?
It takes effect retroactive back to July of last year.
Okay, so part of the request coming up, I think, relating to the jail may have repercussions, may relate to that. And I'm going to let you talk about that when that time comes, which that time has come. On the itinerary, we have Sheriff's Department, we have inmate medical, which was $308,000 taken out because of the snafu at the state level. And we have an additional appropriation request that I think can probably only be discussed. So we have, I know, Stacy and Josh, right?
No, Josh is not here right now.
Okay. I'm sorry, I don't know everybody's name in the county.
No problem at all. Good afternoon, everybody. Thank you for this opportunity to talk to you. In the spring of 2022, we all knew that we moved the inmates, we moved the Sheriff's Department from the old jail to the new jail. From 100 to 120 inmates to now 200 to 220 inmates, and sometimes even more. We've asked our nursing staff to do the same job with 100 to 120 inmates as we are asking them to do to 200 to 220 inmates. So we've added another 100, 120 more inmates on their plate of responsibilities and job duties. Last year, we were with Advanced Correctional Care. There was some discussion, disagreements on things of how to do things and how to properly do things. So we went with another company called Quality Correction Care, which is QCC, and I'll be telling you, or I'll be saying QCC. So if that's kind of don't understand what that is, that's Quality Correctional Care. So QCC started with us in November of last year of 23. And by that time we still had 3 nursing staff, or a nursing staff of 3, 84 hours a week. and that was 12 hours a day. So they would work 3 days, and then we had one nurse that would work one 12-hour day. Since then, we've had two of the nurses, which is a mother and daughter, they've resigned and going to other positions, and that's perfectly fine. When they were talking to us before they resigned, they were talking to us about the stress, being able to keep up with the responsibilities, the law changes, the policy changes, things like that. So I went back to QCC and I talked to them to see what else we could do to give us more coverage and to help out. Because not only does the nurses take care of the medical stuff, but they also help out with the dental, the imaging company that comes in and does all of our x-rays. They also schedule inmates to go to other facilities for x-rays and so forth, so on. And then on top of that, we have withdrawals. We have folks that comes in with withdrawals. Just to give you one example, one person ended up at the Sheriff's Department and was arrested, went into withdrawals. A couple of days after being there, we had to take him to the local hospital and then take him to another facility. He was kept for 7 days, and the bill is $196,000 just for one person going through withdrawals. So right now we have two individuals that's being observed closely that are going through withdrawals. That's kind of a stressor on our nursing staff right now, because right now we have one nurse. We've actually taken two of our correctional officers off of their floor responsibilities and duties to help out with the medical. They've been trained, so forth, so on, but now we've taken two of our correctional officers out of rotation in order to help the medical out. So QCC and their representatives and us, we sit down and we talked about what are our options, what are our possibilities. So one of the things that they came up with, and we actually really like this, it is actually maintaining a 40-hour nurse week. So from 8 to 4, and I'm just throwing these times out, these times could change a little bit, but from 8 to 4, we would have a licensed nurse on facility Monday through Friday. From 6 a.m. to 6 p.m., we would have 7 days a week, we would have what they call MTPs, which is medically trained personnel. These folks are going to be trained by QCC and professionals. So they would have limited responsibilities, but however, they could take a lot off of the plate of our registered or our nursing staff right now. So they can do the vitals, they can start the assessments, they can make the phone calls, they can call the pharmacies, they can call the provider. On the weekends, then it would be an MTP for 12 hours both days. You know, we're dealing with a lot of individuals right now that is, we have, as of Tuesday, we had two of our inmates that have been diagnosed with autism. And before that, we've had 3 or 4 that had been, it was court ordered that they were not competent to stand trial. And so we have to maintain that while all of the process goes through of going through the lawyers and so forth. So that's extra care that we have to give them. With the 40 hours of nursing that I just explained and the 84 hours of MTP time that would be at the jail. Now that's from Monday through Friday, we'd be double staff. We'd have 2 medical staff, 2 medical personnel there all the time. From 8 to 4, we'd had double people there all the time, double medical staff. And then after that, we would have the MTPs. Now, one of the things that I really don't like is the fact that when we took our 2 correctional officers off the floor to be able to help out with the medical staff, that meant that our officers was passing out medication. I don't like that. I don't care for that. With this option, our officers wouldn't be passing out medication. QCC and the medical staff at the jail that would be assigned would be passing out the medications in the morning and in the evening. They would also be doing insulin checks, so forth, so on. There may be a 5-day or a 5-day a year when QCC does give their people holidays that we may have to, but we can deal with that rather than every day. The Henry County Sheriff's Office is going to have to, detention center is going to have to at some point in time file for a DEA license to be able to hold narcotics for that purpose of withdrawals. Ativan and I just forgot it. Librium, yeah. Thank you all. And so with that, we've got to have a DEA license in order for that to be stored in our facility. So with the 40 hours of nursing, the 84 hours of MTP time that would be assigned, that would be an additional $52,000 on top of already what's in that was the contract. That would give us double coverage. Now, they gave us plenty of other options. Some were higher, some were less, but this is the best for us. This is the best for them to do scheduling, because we sure don't want to get into a situation where they hire a nurse and that nurse says, you know what, I don't like working in corrections. I don't like this. I'd rather be going back to a hospital. I'd rather be doing this, or I'd rather be doing that. You know, it's not for everybody. So that's kind of where we're at. The withdrawals, the policies and procedures that are in play now, policies and procedures are constantly, especially in law enforcement and especially in incarceration, it's constantly changing. The company that, our policies are 11 years old. They were written back in 2013. We've got a company now that is coming in, revising all of our policies, everything. We've got an input. It's legal-based. It's based on legal-based guidelines, Supreme Court ruling, so forth, so on. It's the same company that's given us the training, the legal-based training, is going to be writing our policies. So there's all kind of changes that's going on, and we got to stay up with the times. We can't just say, you know what, that was good for us back last year. It's not. Things have changed. And what's happened at the jail has completely, totally changed. It has to. And we're getting there. Will it get it right every time? No, I won't. Will hiring, more medical staff, will get it right all the time? No, it won't. But boy, I'd sure like to think we could get it right some of the time. And we could spare some lives and we could help some people out. We've already got 2 of the major programs going on in the jail, JCAP and MRT, which is medical rehabilitation treatment. I just call it MRT. And so we got 2 of those programs working side by side to try to help our inmates and our people. And on top of that, we're trying to talk about starting another program where it's a reentry program. And we talked with Angela, we've talked with JCAP, we've talked with MRT people to try our best to get some kind of reentry program to give them some kind of capabilities to get out. When they do get out, they're not just kind of left outside of the jail. We're trying to come up with the best ways, and I wouldn't approach you with, if it was not necessary and not an absolute, that this is, we're going to have some kind of help with our nursing and our medical, because we're getting people in that's got side effects, health issues, autistic. We've got folks that's got heart conditions, and we've got people that's respiratory issues, hepatitis, all kind of viruses. We even had one person that came in and said he had TB, but thank goodness he didn't. So, but we got a lot of people that are sick out there, a lot of people that are kind of falling short in life. They need help. And sometimes the only place they're going to get it is jail. And honestly, there have been people that gets arrested just so they can come to jail and get medical care.
Or food or shelter.
Food or shelter. And had a guy come in the other day on a $50 warrant and was there. So we just, we're trying, giving it our best, but however, putting our best foot forward is the way to go here.
You don't have a specific monetary request for tonight?
Well, I don't know if that's something that the sheriff has to ask for, or, because I'm a
pretty
department head, but I'm not a
Right. So you're
elected
pretty
official.
much informational, like Angela, what needs that are coming down the pike, that be aware you're going to have asks down the road?
Well, I can definitely tell you that we're short 2 people already.
In correctional officers?
No.
Medical?
No, correctional officers were fine. We're fully staffed. But it's the
That's-
medical.
Yeah, well, correctional officers, you were like 40% shy a few years ago, so I'm
No.
glad to hear something is going properly.
We got a waiting list. People wants to
But
work.
that is a 180-degree turnaround from 4 years
Absolutely,
ago. Well, that's good to hear.
So, but the medical is honestly, we do need the medical, just simply because I need to tell QCC what our intentions are. So,
Who's our liaison? I don't have that memorized either, because we have 30 different liaisons in the
We have-
The
department.
Sheriff's Department?
We have 3 of them.
Yeah, Shannon and Harold and I.
Okay.
I think that they are requesting additional inmate medical funds.
And we approved, what was it, 100,000 in January?
We moved 50,000 out of 2 different funds into inmate medical, and that was on January 10th. And it didn't take long to eat that $100,000 up. You just heard about the one incident that I've got questions about that. That number's a lot bigger than I thought it would be. $196,000 for 7 days.
well, that was kind of an extreme. That's where we could be going.
Is that
Is
this
that a
year?
bill that we got that we have to pay?
No, we haven't got the bill yet.
But
It's
we are
28,000. It was 28,000 for 5 hours out of Henry County.
So you're expecting a bill for 196,000?
I don't know, because there's going to be some scrubbing that's going to be done,
Right.
discounts that's going to be made. So I'm just saying, if you take 28,000 times 7, that's kind of, if we take the high
And
end
that
of
doesn't
it.
count the manpower that you had to send up there and station guys up there.
That was not counting the manpower, because we had
Which
to pay
means we were running 2 officers short because the man was violent.
Yeah. Yeah, he was violent. We had to restrain him. We had to keep 2 officers up there the whole time. Well, not the whole time, but when he was kind of more calm, then we would leave 1 officer up there.
And none of that can be charged to Medicaid or anything like that?
Well, and that's the other thing. Some of it may be charged, because that's one of the other responsibilities of the nurses. When they do their clinicals, they also sit down and sign people up for HIP and for other insurance, programs and so forth. So this is really, the nurses actually do quite a bit more than just, just do assessments and such.
So Stacy, I know we pay QCC like a monthly fee for our contract. But we still experience other medical bills, you're saying, for hospital bills and other things like that.
Yeah, we can. We
So
sure could.
just, for the council's information, we did not even budget enough to cover the contract amount. We budgeted 308, and I think the contract is about it's 335. Okay, that's closer. Thank you. And then that doesn't include prescriptions, and then obviously it doesn't include medical expenses from other facilities.
Well, and just thinking about that, QCC, there would have probably been, there was a little bit of history with us and QCC, with Henry County and QCC. So we could have went with some other company, but QCC is in the next county. They're a phone call away. They've always been a phone call away. And I've talked to other jail commanders about QCC and see how, and they've had good things to say about QCC, the administration and things. They haven't always really liked the nurses at their facility, but the administrative part is, you know, they really like them. And that was a good thing about us. We was able to keep the 3 nurses that we had, and then, but now 2 of them have decided to move on, which is a mother and daughter. I don't want you to think that, you know, we're having a massive, everybody's leaving type thing, but 2 of the nurses have decided, a mother and daughter have decided to move on to something else. And so, and that's fine. I've never stood in the way of anybody leaving, but that's kind of where we're at. And to be honest with you, I can tell you specifics about certain things, but as far as, you know, what you all talked about with the sheriff and things like that, I can't answer anything like that.
I appreciate the information. And so we budgeted 308,000, 333, what'd you say?
335.
335. So 335 is what the actual contract is. If we say at least 20,000 for prescriptions, it's 350. Okay, so optical and dental is extra. Was medical supplies in a different line item ever, or as it always? So it's always paid out of that line item. And so if we look at additional nursing staff and then covering some of these facility bills, I guess the takeaway is that we're under budgeted in inmate medical.
This contract, was it signed in December? I mean, did we not know these numbers back last July?
Yeah. Yeah.
So we did not know these at budget time. That's why we under budgeted. We didn't know.
Well, we didn't even know about it until Advance called us like 30 days before and said, by the way, we're not renewing our contract. And that, oh, well, I'm sorry, I didn't know that.
Unfortunately, we only do budget hearings once a year, and a lot of information is not at our fingertips when we do that in July.
Now, this contract does cover 84 hours. So the additional 40 hours that we're talking about, which would take us up to 124 hours, that's for the 52,000. That's for the year, for an additional 40 hours of medical staff.
So when we set about doing an additional appropriation to put the money back in jail lit, we may need to think about putting a more accurate inmate medical amount in
Right.
the jail lit.
Right. Everything we took out because of the state snafu or whatever typo came to about 415,000. And we do need to get that back in. And we'll have to find out the best way of doing that. It sounds like you said that was retroactive. Should we be able to act on that in some extent in the April meeting?
I believe so. We'll just need to get with the sheriff's department and get some accurate numbers, clearly laid out what we need to do for an additional appropriation for April. And we can have it in our April meeting.
Oh, okay, for the
And it will-
52,000 or?
Well, it's going to have to be more than that, because right now that we shortfalled that line item by $308,000. So there's $100,000 in there that's already been spent. We need to figure out what the actual number is for the additional appropriation to make sure that you're taken care of. So,
And just not just the nursing staff, but for other
correct.
things.
Yes.
We took out uniforms out of jail. We took out janitorial supplies out of jail. We took out inmate supplies out of jail lit because,
And we knew we would have to put it back in.
right. So we have that
Once that
out
was
there.
passed.
415,000 we knew was shorted because we had to meet the Indiana code as it was written at the time. It's since been corrected, so it's got to be put back in.
Well, and honestly, like I said, there's a lot of jail standards and policy and even rights of the inmates that just short of it wasn't being followed, that we have to follow them. And so, you know, that's just kind of one of those things that you got to look into it. You got to do it. So, thank you all.
Thank you, and I
Stacy?
apologize.
Yeah.
Did QCC mention anything about the durations of their contracts, or have you guys discussed that at all? Because it seems right now the the timing of things. It would be beneficial if we have to do this to get it done now, and if it's a year contract, then when a year comes around again, it'll be right before we're going into budget sessions. It'll just make that process of budgeting for the next year easier versus getting a contract in October after we've already done
I don't think,
budgets.
I think it was more than a year, to be honest with you. I can't see it being a year contract.
Okay.
Yeah.
Can we pencil in 2028?
But I can't think of any reason why they would do just 1 year in trying to get all this accomplished. So that makes a little bit more sense.
So they're amenable to various terms.
Yeah.
They're amenable to open
And I think it is, you have like a period of time, and Joel, I don't know if you looked at this contract or not, but you have a period of time. Okay, you have a period of time that you can say, hey, you know what, we're not satisfied with you folks. You know, we're going to look at someplace else, but there's like a time period there that we got to give them notice. So it's just not like, hey, tomorrow you guys are done. So.
I was going to say, I apologize to Lieutenant Martin. Yeah, I knew your face, but you're on the homeless committee that I know, Angela, you were at that meeting over in the place. I knew I'd recognized you somewhere, and I knew you weren't Josh Smith. But the more I sat up here listening to Stacy, I go, I know you. I'd seen you at one of the meetings, and I know there's a lot of things going on in the county trying to address the transitional housing, homelessness. There's the CDC grant, the Drug-Free Communities grant. There's so much going on. I think we're probably the poster child in a lot of areas. I mean, we're doing things, and I'm as frustrated as anybody that some of the limitations we have, and a lot of it goes back to Indiana code and the time frame that we get information. We get the comprehensive plan, I think, because I think Baker Tilly has to wait on information from the state, which comes from Debbie's office. And until she able to fill Baker Tilly in with the information that they request from the auditor's office, which comes out from the state at certain timelines, there's a reason we don't get the comprehensive plan until June. You have to provide him a lot of information, and some of that information doesn't come in until, does he? I know he has to wait on our tax receipts, property tax. That's one of the things. A lot of it comes from the state. A lot of it's
We can ask the question if it can be done earlier, but I think we have asked the question
We
before,
have.
so we could see.
We have, because we'd like to have it earlier than 3 weeks prior to
Right.
budget hearings, because there's a lot of information in it.
I wanted to say also, just for next steps, right now, the number for inmate medical is $308,000. So you technically don't have enough money to hire additional nursing staff, but we need to find out from the sheriff's department what is your more realistic inmate medical number, and then we will vote on that at our next meeting, if that helps you.
Unfortunately, we're going to have somebody, we can't have one person there the whole time. So QCC will be the one that will hire them. So it may be one of those things that we just, because right now we got we got one nurse that's working 12-hour shifts, and then we have MTPs that comes in and tries to fill in. So we don't want to get it down to a point that we don't have anybody there, because, man, that's scary, honestly.
So we'll follow up with you guys. Thanks.
Sounds good. Thank you.
And QCC, they're working on this need to fill the need that you're describing. Okay. Right? I mean, is that correct? They're working on knowing that you're short-staffed.
Oh, yeah.
They're working
Yeah,
with your department to fill the need.
Yeah, they're full well knowing, they just want to be able to move on to get a consistent flow in there. Because last thing we don't want people from Evansville coming up here working a couple days, and then somebody from,
Absolutely.
from Indianapolis working a couple days, and we don't want to do that to our inmates. That's, we want a consistency.
Your officers, Stacy, are they MTPs? Do they have that training? They don't?
They've got some training. They got, how to do it and things like that, but not the training that I feel comfortable with, because MTPs can even be paramedics or EMTs. Our people aren't EMTs. They're just helping the nursing staff to try to
Maintain.
alleviate some of the stress.
I'm just thinking if some of the officers, and if there was any overtime line item budgeted that's available still, a way to shift funds around to cover things in the time being versus.
Right. Well, I mean, we're gonna have to do something, because we definitely can't operate on one nurse.
Thank you.
Thank you.
Thank you. Thank all public safety entities in our county for what you do. We have next the insurance premium increase discussion. I believe Shannon and Susan had a sit down with Josh. We're trying to read the tea leaves as to what's anticipated. And I don't know if you have any information of what's forthcoming or not.
We don't have any tea leaves. We don't have an invoice yet, but the end result, I think, and the commissioners have discussed this, is our insurance premiums will increase by over $230,000. And I wanted to make certain we had a discussion tonight to have, we're going to have to add additional appropriation to pay it. So where will that additional appropriation come from? That's part of the discussion. Where is it going to be paid out of?
That is the question of the hour. We're going to have to find it, or we're going to have to. We're beholden to the state.
Mm-hmm.
We can raise taxes, we can raise fees, we have to find it. One way or the other, we don't have an option. Come December 31st, we have to be zeroed out and in the black. So, good question.
There's a possibility that premium increase will be more because we have other lines of coverage coming up in June, I think. So it is possible. Yeah, go ahead.
Yeah, so we were able to keep travelers. I don't remember the three. You guys may have that piece of paper for 3 items. I think it was inland marine. I don't remember the 3.
Crime and property.
Yeah, thank you. Crime, property, inland marine. We were able to keep those. Currently, for the property, our deductible is $5,000, which we're keeping since we're in the hail season. When we quoted with the carriers that were amenable to quote, and they quoted property, everybody was quoting $100,000 per deductible per property. That is a trend across the country. So not saying that that's what's going to happen, but we're anticipating that even if Travelers requotes it and keeps it, or somebody else, we're looking that those deductibles are going to increase exponentially as well. From the $5,000, we were able to keep every deductible down to $25,000, except for the law enforcement liability that increased. So that was good that nobody else, it didn't increase, but yeah, we are potentially looking at a larger increase in property in deductibles July.
My understanding, and I did listen to it online, but I slept since then, was that the liability was $250,000 deductible?
No, law enforcement liability, $150,000.
$150,000, okay, that's a little better.
Yeah.
So liability deductible went from $25,000 to $150,000.
Yes, sir.
150, thank you.
Though we had a discussion, I'm sure you've had the same discussion with Josh. Every time we settle a case, we don't pay out our full deductible. So it doesn't mean that we will pay out $150,000 every time we settle. It just means our exposure is much higher.
Correct.
So
anything over any settlement over $25,000
Right.
is more exposure
Right.
than what we have right now. Correct.
right, and just for our budget this year, we probably won't pay a lot more out in deductible because of timing. Most cases that we've already had filed will probably not be settled by the end of the year from a timing perspective.
That's
it takes time to move through the whole process. So most of our exposure for the deductible, we won't really see in '24, but it'll be an issue during budget time for next year.
Right,
yeah.
because any claim, whether it's an accident or a car accident, or if somebody falls and breaks their leg or whatever, any claim is date of occurrence, not date of filing. So anything that happened prior to March 1st, travelers will be covering at the $25,000 deductible. Anything that happened from March 1st forward, then we are subject to the $150,000 deductible.
Right.
So it's occurrence-based, not when it's filed.
Right.
So hopefully we know a little bit more specifics and amounts come budget hearing time. But I don't know how
Well,
much more we'll
as
know.
Shannon and I there's no fix for it really, other than that we're going to have to maintain a fund to pay large claims,
Well, and then and again.
like an insurance fund, like a health insurance fund is what I'm saying. I mean, we have exposure that we could go a full year without having a lot of additional costs, but then something big happens and our exposure is much higher. And that money will have to be set aside.
And most of those are tort claims, is that?
They're notice. Yeah, they're notice. Yeah.
Was it 10 of them that Josh mentioned? Was that the number he brought up of potential tort claims?
11.
11, okay. They
were spelled out in today's Courier. I learned a lot from reading that article. When somebody sues, they cast a wide net of anybody that could possibly. I think we were only mentioned in 2, so we were better than the actual city council.
The commissioners are mentioned in all.
I noted that. That's typical since you signed the contracts.
It absolutely is. We are mentioned in all of them.
Yeah.
So that 11 at 25 potentially is exposure that exists. Kind of the hard and fast number since we're past that March 1 date.
Right. For easy calculations, if you just want to do 10, then the exposure is up to $250,000 for that. Yes. Yeah, that is where you got the 250.
The question is, where do we get the monies to fund that fund that you alluded to?
Well, we got to fund the fund, and we got to pay the premiums.
The
And
premium's a given, we have to.
right, and
That's a known.
I'll share with you that the document that was shared with us, the difference in the law enforcement liability premium was $153,650. The difference in the general liability premium was $44,222, and the rest really is in automobile. So that's a big chunk of additional dollars that we will have to come up with at some point. The bill isn't here yet, but when it gets here, we're going to have to additional appropriation to pay it. So it's either going to have to come out of the general fund into some line item, the insurance premium, into legal. Okay. Is that where the insurance premiums are paid out of generally?
Yeah.
But additionals, you would all take out of legal? Or are you talking about the deductibles? Okay, deductible makes sense. So we have line items for insurance premiums in the sheriff's budget I'd have to look at the budget.
Is it all in the commissioner's budget right now? Yeah.
There's a line item in the sheriff's budget for insurance, and then
The majority of it comes out of,
It's commissioners.
yeah.
highway,
We,
EMS, they all have a portion of the insurance as well, and then the additional that comes out of the commissioner's budget.
we budgeted $25K for.
For extra legal
sheriff insurance,
expenses.
Because there were 2 claims at the time we did the budget hearing, and so we put 20, because that was the deductible at the time, was 25,000. So that is in there too. That may not last very long.
Shannon, were the 153,000 and change and the 44,000 and change, were those the differences based on what we had budgeted and then what it's going to cost the rest of the year with the new premiums?
That's my understanding. It's the difference moving forward. So I don't.
That's the increase.
Yes, that's the increase. Whether that number will be exactly the same at budgeting time, I don't think we know yet.
About 200,000 additional just in premiums.
230,000.
230.
234, roughly $234,000, somewhere around in there.
So is our automobile insurance all under the commissioner's budget, or is it also spread, Debbie? The automobile insurance specifically, is it spread, or is it all in the commissioner's? It's spread too? Everything is.
Yeah, everything is spread out amongst all of them.
Okay.
So we're really going to have to decide if this comes out of general funds or if it comes out of public safety lit is really our
Can we pay
only-
from safety lit? Yeah.
I mean, we don't have any room in there. Everything's budgeted in public safety lit, but we would have to move things around.
Probably definitely pay long-term liability out of safety, but I think some of the others that we said would be able to take out public safety, even if we take a portion out of it, but I think definitely.
Okay. I think we need to discuss that and come up with exactly what those numbers are for additional appropriations. This one probably doesn't have to be done in April because we don't have the bill yet. Do you think we'll have the bill by April, Bobby? Do you know?
I would anticipate it, I'm sorry? Well, because we did the new, well, and I'm not sure because we went from one carrier to 5 carriers, so I don't know how each carrier is going to do their billing. So it's not going to come in all in one nice wrapped up bow invoice. It's going to come in multiple invoices.
So it may be like the QCC contract. It may come after budget hearing, which means it's, again.
I would anticipate that we would get it before because four of the 5 were brand new to them, and I cannot imagine that they would wait 90 days or 6 months or however long it is
To bill, yeah.
to get any type of.
I would think we
payment.
would have them. We don't necessarily have to do this for April, our April meeting, but we probably will for May.
Yeah.
That's my
I would
anticipation.
anticipate that we should have something by then, I would imagine.
We'll have exact numbers that we need to pay, and we'll need to figure out how much we want to budget from where. So,
I
The
would
premium's going from, someone else was talking?
Go ahead.
Oh, I'm sorry.
I'll make a comment after you do.
The premiums are going from about 600,000 to 800 some thousand, so we're not going to run out of money for a few months, right? I mean, we could not do anything till June or so.
did we pay them monthly?
Oh, okay. Oh, it's one annual bill. Okay. Never mind then.
It'll be 5. It'll probably be 5 annual
Well,
bills now.
we have 5 different carriers now, so, yeah. I mean, theoretically, you can run it in the red until you get to the end of the year and do the additional appropriations to get everything back into the, I don't like doing that, but you can run it in the red until, don't like doing it, but you can, as long as you're back to zero by December 31st.
And they're probably going to bill us sooner than later.
Okay, thank you.
Better than I thought. And I forgot what I was going to say. So, moving on.
Is
Unless
there
anyone else-
anything that can possibly be cut going forward from insurance to balance things out as far as
Cut like,
like
Like-
coverages or anything we can do to reduce our exposure outside the box thinking, whether it be, I don't know how many employees drive their vehicles or county vehicles after hours, those types of things. Are those things we can explore?
sure, I mean, we can explore all options. I mean, my guess is if people didn't have take-home vehicles, I don't know that the exposure would drop $234,000. But it is something that we can have Josh look at.
Or if sheriff vehicles, an example, would be limited to business within Henry County alone.
Yeah.
One example.
I mean, those are the
And I'm
things.
sure Josh works with us pretty well, making recommendations where we can
Yeah,
save and prioritize.
he would have to talk to the underwriters of the carrier and the underwriters to see what they would be willing to do. I mean, I can ask him to do that. I don't have a problem asking him to, what can we do? Think outside the box.
even going to make a dent, though. That's the biggest.
Right. I mean, even if you save $60,000, that's $60,000.
817 is how much the auto insurance went up.
57,000.
57, yeah. The umbrella insurance went down, and I
Public officials went down, I think, as well by $4,000 or somewhere
yeah,
right in there.
$5 million umbrella policy is not a lot in today's world, but that's what we're getting. So,
Anything else, council, on this subject matter? Thank you, Bobby. EMS lit discussion, that kind of dovetails with some of the other things we talked about. I know after our work session on 22nd, we had a meeting shortly thereafter with Rex Peckinpah and Mike Guffey from the Newcastle Council because they asked us to meet. And so Susan Shannon and I sat down, and I think the thrust of the meeting had to do with EMS. We talked somewhat about public safety, but I'll turn it over to you because I'm tired of talking.
we had, like Kenan said, the previous work sessions, and we talked about being able to provide funding for EMS. EMS lit is available to us to pass as a new tax rate. We do have a $300,000 payment for EMS in the public safety lit payable to the city of Newcastle. That was one of the topics of discussion with the Newcastle City Council. What's that look like now and moving forward? Of course, there's no belief that that number will go down. But looking at the opportunities in public safety lit, if we're going to allocate dollars of some of that to try to pay for insurance, should we pay dollars to the city of Newcastle out of a new EMS lit? And if so, what is the right amount? We cannot pass anything tonight. We will need to have a public hearing and do all of the appropriate things. But I think we need to have some discussion on what that proper lit amount is. The discussion we had with Mandy and Brian when they were here, and Commissioner Plummer sat in as well. You know, those numbers are not small. They're needing, our Henry County EMS is needing $400,000 or $500,000. The payment to the city of Newcastle is right now $300,000 with opportunity to increase. We have previous information from the PSAP lit experience that basically 0.01 brings us in a little over $100,000. Well, if you look at 500,000 and 300,000, that's $800,000. A 0.08 tax rate would bring in that amount of money, or darn close to it. So we need to have some discussions about what the appropriate EMS lit rate, if we want to pass an EMS lit, is, and get it advertised, get it voted on as soon as we can. So open that up to the council for further discussion.
Well, I think, get your thoughts on this. You know, the EMS we can do unilaterally, but it's going to, part of what you brought up is the fact that it affects what we've been paying $300,000, which would be that 0.03 part of just on that alone. The other 0.05 you alluded to would be given what Mandy and company shared with us at our January work session. But we have to also, I think, balance out total the public safety lit. We know that the fire departments are going to come clamoring. Know that for a fact, because we've heard from some of their chiefs. One of them was in attendance at the DLGF meeting last week. That's going to take a tax council, which is going to necessitate, how many letters did you have to send out? 50 some odd? There was a lot of letters by law. So I think when we have an EMS discussion, we also need to also kind of at the same time balance out a public safety discussion.
I don't disagree. The only thing I would add is we cannot have the public safety lit discussion without involving the tax council to find out what everybody's needs are. The EMS lit, we can have that discussion to meet our needs and then discuss the public safety lit with them, and our needs can be combined with theirs to decide what we're going to do with public safety lit. The EMS lit, we can get moving sooner than later. That's at our discretion.
Right, and I agree. It's just, when you combine the total, I'm going to.
The total tax rate.
The total tax rate, I'm going to side with the taxpayers. Because we've already done a jail lit, we've already done a PSAP lit, we've already done this, we've already done that, we're talking about this, we're talking about that. You know how I feel. The reason I even brought up the public safety lit is because if we were to approve a .08 and we come in and say the need for public safety after the fire department comes, here's another .8, I can tell you right now, I'm going to scream. As a taxpayer and as the taxpayer, I've mentioned time and time again that our constituents, our taxpayers, are probably taxed enough because the median household income is there's about 70 counties that are better off than we are, yet we're right in the middle of what we tax. So I'm not running for office again. I'm not saying it's because I want to get reelected. I'm tired of just raising taxes, unless there's a very legitimate need. The jail was a very legitimate need. PSAP was a very legitimate need. Now we're getting into territories that anytime there's a need because we're shortchanged from the state, they give us the avenue to raise taxes.
We need to continue to pressure the state. I mean,
Well, I agree. I would agree with Angela on that statement. It's a battle all the time. And I think our legislators are listening, but it's an election year, and that's why they extended the .4 AV, the 4% another year. It's an election year. We help save you taxes. So that's upon us to make up for their shortfall.
Completely agree. I have no interest in raising taxes. However, if we're going to cut services because we don't have the money, somebody needs to point to me tell me what services we're going to cut because we don't have the taxes to pay it.
Well, that's been a discussion we've had ever since tax cap's gone in, and it's a matter of prioritizing. I mean, again, the jail was a need. It would have been much less money if that can hadn't been kicked down the road for 12 years. PSAP was a need. I mean, people need 911. That's a safety issue.
these are vital services. I mean, to me, the number one responsibility of government is to provide public safety. So
Absolutely. And this is a critical discussion here, too, because
And if the state picked up those services, they would raise state taxes. It's just
They won't do that.
It's just where are you going to pay? They're telling us what services we have to provide, and those services are getting more and more expensive.
they're unfunded mandates. They look
Right.
good. We have to make up the difference for them looking good, whether it's tax caps or whether it's them limiting the assessed valuation to 4%. We have to take the brunt of their decisions that make them look politically well so they get reelected.
My interest in pursuing the EMS lit is to not kick that can down the road further.
Agreed. I think there's unknowns. Maybe we'll know more by the time we have the discussion, but anyway, the vote may go 6-1.
Completely understand.
Maybe we just completely cut Joni's community corrections budget.
That's why, she knew you were going to say that. That's why she showed up. Well, that's another state decision, isn't it? That's pretty much a state decision, right?
How much of your budget comes from us?
And you stuck in here an hour and a half and knowing that. She stayed here patiently listening to us on things that just barely affect her.
Just to clarify for the live stream, thanks, Travis.
Oh. Well, I know when we gave raises, the issue came up. I don't get enough from the state to be able to meet the raise that you're talking about. And I think that's kind of what Angela was talking about too, is we make a decision, and it affects a lot of people.
Can we all agree that the state doesn't give a damn about what our problems are when it comes to funding?
Is that a motion?
Yes.
It's pretty obvious.
I think that we
Guarantee it's 7-0 if you
have
have.
to operate under the assumption that that's just well, I'm going to leave some of my dad's old sayings out of the public sphere, but you do something in one hand. No.
Yep.
You got to face things with
It's the reality.
toolboxes or the tools we have in our toolbox. So.
Okay. So I agree with Shannon, we need to have that discussion in April. We can even discuss it a little bit more fully in our March court work session, which is coming up on the 28th.
I have a question for Joel or Debbie, I guess. Are the notifications for lit discussion different than the notifications? I know they're different, but time frame wise, are they the same for additional appropriations as they are for lit vote? If you could, let us know. We want to make sure we got the right dollar amounts and timeframes, everything before those notices go out.
Okay, anything else on EMS, Shannon, or, we did talk about, I think at the work session, the legislation cut back the judicial tax, and it was just to the courts, where last year, and that's retroactive also, last year it's prosecutors, public defender, probation, community corrections, Joni, and now it's just judicial courts, and it's a maximum of 50%, so I don't know what that, we'd have to research what the court budget is. I know I have that here.
It reduced the amount that we could create a judicial lit from almost $1 million to 177,000.
So that'd be like a .01,
Yeah,
would help us out in that.
we could do a judicial lit for .01, which would cover part of that, which is certainly an opportunity if we wanted to do that.
So it comes down to judicial EMS, safety. The jail lit will give us flexibility. When we had to take that 415,000 out, that was a monkey wrench we were not expecting. But they did right that ship that kind of was sinking last year. So anything else? I've got updates for you. We kind of touched on the Senate Bill 33. I shared with the council the process when the fire department, that's to clean up some, the House Bill 1454 from last year. There's a process they have to come. If they ask for money, we have to grant them a hearing. Then it comes to things we may have to do. It's not that we shall have to do. And I shared that when the time comes, that's delineated pretty well in the legislation. And Shannon brought up House Bill 1121 earlier in our discussion that we had. Any questions about that? I've been sharing, from my Zooms, I've been sharing updates, I think, pretty regularly, and asking if you have any questions, let me know. We've got AIC Central coming up on the 25th in Hagerstown. I'm registered. I don't know if anybody else did or not. Debbie helps with that registry. And you're still an officer, are you? In the region, what are we, 6? Anyway, East Central Indiana region. And it's in a nice location. I would think that would be an incentive wanting to go, but at any rate. Work session on the 28th. We've got ARA, the health department, further discussions, probably further lit discussions. Council meeting coming up on the 10th of April. We need to pin down lit discussions then, at least certain ones like EMS. April work sessions on the 25th. That's for the jail pods with the commissioners, judges, and sheriff. ICCA annual meeting. Highly recommend it. I think Shannon and Betsy came in and out on some of that. That was very good. That's at Renaissance in Carmel on June 22nd.
It was really informative. And it's nice, it's always nice to network with fellow council members around the state and realize we're all facing the same battles. It's validating and frustrating, but.
The battles we hear here is going on statewide, I believe, in most 92 counties, with the exception possibly of Hamilton. With study update, we haven't heard anything more from Addie, right, since our work session. I mean, they've met with all departments, I think, and they're hammering that out. Family maternity leave, that going to be a future discussion? I know I've seen emails
Yeah.
this past week.
I don't know that we really need to talk about it at the council meeting. It's just a specific instance for a family maternity leave issue that the commissioners are working through with
Okay.
Josh.
Okay.
We were just
I just
along for
read
the
something.
ride, so to speak. Yeah.
Okay. Well, that's going to be a.
It will be
personnel
very
handbook.
relevant when we do the personnel handbook.
Okay.
It's being started, but I think
And you
for
guys
now,
are-
it's.
And you're on
it's-
that, and I'm not,
Yeah.
so. Public comments, thank you, Tom, Joni, Rita, Press, Travis. But if you could take care of that, note that it's going to be a joint session, the work session on the 28th. Yeah, I just skipped ahead to the.
So is it April or March or April?
The April one's the 25th on the jail. Health Department on the 28th of March shouldn't, it's not a joint, that's just, we got to discuss. ARA's coming, the rep's going to update us, the Health Department, Angela will get more specifics there, and then we'll continue the lid discussions after that. Okay, what else? Public? Anybody else?
I was just going to say to Mr. True, since you just got the PSAP funds, right? We're talking about those. That's a new revenue stream that we have. Any insights that you ever come up with from that experience, it being a new revenue source for the county, for you? Please pass them on to us, just as we're talking about other possible, taxes to explore, new ones that we've never adopted before. So any insights, I welcome them, man. Thanks.
That brings up, before we have a motion to adjourn, Brian, page 3 of the packet that Debbie provided us from January 18th, is Brian, due to timing of the 1235 PSAP, no funds were budgeted in 2024 and the following. Is there something we need to address on that? Again, refund on my lobotomy. Thank you. Motion to adjourn?
So moved.
So moved.
Second? Good. Thank you. See you in a few weeks.